Prostate cancer is the most common non-skin cancer among men in the U.S. And if that's not enough motivation for you to schedule a screening, we have urologist Dr. Matthew Purcell here with us today. He's with the Simon Williamson Clinic at Princeton. First of all, thank you for being with us.
Thanks for having me, Janet.
We talk about prostate cancer being so common with men, yet many men don't get the screening they need to. What's your pitch to them? Why do they need to get this screening?
Well, when you say common, it really is 1 in 6 men throughout their lifetime will be diagnosed. It's more common in certain populations, so if you've had a family member who's had prostate cancer, uncle, father, brother, cousin, African American population has a higher risk. But a lot of men don't want to get the prostate exam. A lot of guys don't want to deal with it. And so it is important. It's important to talk about.
Okay. What are there symptoms of prostate cancer that they should be aware of?
Well, that's one of the tricky things, is that prostate cancer really doesn't show symptoms until it's too late. So by the time you notice a symptom of the cancer, then it's probably already spread either to your bones or somewhere else. A lot of guys come into my clinic and say, "Doc, there's no way I can have prostate cancer. I don't have any symptoms." And that's kind of the problem with prostate cancer. So we do have a screening process. It's not perfect, but it's the best we have at this point. And it consists of 2 things. One, it consists of a blood test. So the, excuse me, the PSA, that's the prostate specific antigen. That's a blood test that we take. And the second is a prostate rectal exam. And that's the part that keeps most of the men out of the doctor.
Sure. But it's very quick, correct?
It's very quick, very painless. So mostly they have to get over the embarrassment of that. Now, one of the things I wanted to talk about during this time is there's been a big change in prostate cancer screening recently. The government, the U.S. Preventative Task Force, what they have done is they've actually downgraded PSA screening. And they, in 2012, they said, we do not recommend prostate cancer screening. And so this was a big controversy at the time. They have since come up with a modification to that, and hopefully sometime in 2017 we're going to see an update to this where they actually get in line with other cancer societies and re-recommend prostate cancer screening.
So what do you recommend in terms of age? When should a man start getting these screenings?
That's a good question. So for the general population, we would say probably between age 55 and 70, you should discuss this with your doctor if prostate cancer screening is right for you. Now, if you have higher risk, probably starting a little after age 40, you should at least have a conversation with your doctor and get checked. Now, part of the controversy is that prostate cancer is a very slow-growing cancer, and a lot of guys may get false positives and false negatives from the PSA screening. They undergo biopsies and have all kinds of side effects. And even though we can treat this cancer, a lot of the side effects can really impact a man's way of life. It can cause impotence and incontinence. And so for this reason, that's why they've told us we may need to limit or at least have a discussion with our patients and not just screen everybody.
Okay, so bottom line, talk to your doctor. Don't be embarrassed. Just get the question out there and get the answers you need.
That's correct.
All right, Doc, thanks for being with us.
Thank you.